program is brought to you by P. Murphy and Associates, successfully providing IT professionals to Southern California businesses.
Hi, this is Marlene Gibb with What Do You Do? And today's guest is Chris Tucker. And Chris, what do you do?
I am an acupuncturist and a QiGong instructor here in Monrovia.
And first we're going to talk about the acupuncture, right?
Yeah, let's talk about acupuncture.
And you just got done telling me your dad was a physician.
Dad is a physician, or was a physician. He's retired now.
Okay.
Yeah.
And you chose to be an acupuncturist, and
yes.
Yes, and that didn't go over too well in the family.
Well, it didn't go over poorly, but I think they would have liked
the physician.
Yeah, I think they would have liked me to be a physician. It's a little more mainstream. But they're happy with it now. You know, they've come around. Acupuncture is way more accepted now than it was, 20 years ago. And I think once these schools, Stanford has a program, all these programs.
Oh, Stanford has a program?
They have electives
in
their med schools. Lots of these very famous schools have electives for acupuncture now. And so I think they're coming around and we're integrating, and my dad's received some acupuncture, my mom's received a lot of acupuncture, and I think they appreciate it more now. So it's not as foreign either.
Right. So tell me what acupuncture is. I've been through acupuncture, but tell the audience what acupuncture is. Because they think these little needles, they get into the needles.
Yeah,
right?
So they're not as painful as everyone thinks they are.
No, they really don't hurt at all.
No, but we are putting needles transdermally. We're inserting needles, and we are into certain channels and acupuncture points to elicit a certain response. If someone's immune system's deficient, we will tonify it, we will increase it. If someone is infertile, there are certain points we can use for that. So
really?
People don't know that's a very wide scope that we can use acupuncture for. Most people think it's pain, headaches, low back pain, and we do all that, of course, but there's this whole other internal world of acupuncture that people they're starting to become more familiar with now. So,
well, let's get into your background. When you went to school, I went to acupuncture school, and what made you choose that over medicine, being just a normal physician?
Yes, well, I wanted to do both at first. I was interested in doing both. I applied to Western schools, and the school I applied to I did not get into, so I said, since I want to do both, and I was going to do Western first and then do acupuncture after, let me go really boost up my application a bit. And so I really got after it in acupuncture school, and did really well and really got after it. And then I was going to apply to Western medical schools again, and my son came around, and so
Logan.
Yes, my son Logan, and I was very grateful for that, and I've been very involved. And so I didn't really feel I wanted to go and disappear for 6 years and bury my face in books. I wanted to really be there during his upbringing. So I've been there the whole time, and I'm very glad I made that decision. So I decided just to go with what I have. I had acupuncture, and I'm really grateful I did that now. I'm part of Logan's entire life.
What about you go 4 years to acupuncture school, right? You mean you came out of regular college with a 4-year degree, or did you just go to acupuncture school?
No, I went to
4 years.
Regular college. I went to UCLA, 4 years there. And then actually 5, but went there, and then after that I had enough credits that as I said, I got after it in acupuncture school. I finished in 3 years.
Rather than 4.
Yeah, you have to do at least 3 years. So 3 years in the state board exam. That's acupuncture, Chinese herbs, a therapeutic massage they call Tuina massage, cupping, which we do a lot of in my office here in town.
We'll talk about that as we go on.
Yeah.
How did you just decide, because you came up with a traditional Western background.
Yeah.
What was that changing point or time?
It really was when Logan was born. I did not want to, as I said, I didn't want to.
That was nothing else. I mean, that you did, was
I
there
mean,
anything?
now I think maybe I could go back, but right now I'm pretty happy doing what I'm doing. I've investigated PAs, physician assistants, and maybe that is something I might, because the whole goal is to integrate the two, and I think that would be really helpful for healthcare as a whole, not just acupuncture, but if we play to our strengths and not so much, there's these compartmentalizations of this specialty and that specialty, and I think if we all learn how to integrate, come together, it'll just better serve the patients, and I believe it could keep costs down too. If you could have an acupuncturist do some things that you would normally go see a primary for, and this is happening with PAs, nurse practitioners all the time. People are very well trained, and they're taking upon themselves some of the load that normally used to go to physicians. And if we can keep it out of the ER, if we can keep it out of, some of these more simplistic procedures, then we can, keep the costs down too. And it's better for the patient.
Well, if Stanford is doing this, but you don't do you work with any Western physicians now?
I refer to them, yeah.
And do they refer back?
Some of them do, yes. And that's golden. That's what we really want. That's what I'd love to do, is work more with Western physicians. Maybe talk to them if they're open to hearing about how we could help or what we could do, or, there's other things besides just what they've been taught. And I think everyone as a whole is becoming more open to that.
Right.
And these professional walls are starting to crumble, and the professional arrogance is definitely crumbling. I've noticed I don't come across a lot of professional arrogance from the Western medical world, and hopefully, this is all, a good sign for the future.
Oh, it is. It's a very good sign. Talk about the difference between when you go for a physical with a Western physician versus coming into an acupuncturist, because you do the pulse and you do things so differently.
Yeah. Well, you mentioned pulse. So we have this pretty involved pulse diagnosis in both wrists, and it's not just the rate, which we do look at the rate, but the quality of it. But without getting into too much detail there, we also look at their tongues, which people might find it a little strange when I say.
I've been to. So it feels weird in the beginning.
In the beginning, yeah. And so we usually use that to reinforce a diagnosis that we've probably already come to, or this is how I do it.
With the pulse.
I use that to reinforce. I've asked a lot of questions by then that might be a little odd, like, do you prefer room temperature or cold water? Do you have dream-disturbed sleep? I mean, we have these questions that are a little unusual for people, but we get a complete picture. We really try to get to the root of things and not just the physical ailment that they present with. Try to say, well, what are possible causes of that?
Give me some examples.
Well, let's say someone comes in with digestive issues. They come in with nausea, or maybe they don't go to the bathroom too often and they're slightly constipated. This can come from several different arenas. So we'll ask questions about what someone's favorite foods might be. How often do they eat? The type of foods they have when they have cravings. We'll ask, if it's a gynecological issue, we have to talk about a lot of, things that we have to talk. We have to get into things about the quality of the menses. We have to talk a lot. A lot of questions that people are not quite used to hearing all the time.
They're not. Well, after you have kids, all that stuff goes away. But
yeah, but the thirst. Are you thirsty for hot or cold? water, I think, is a good example. Are you thirsty?
Are most people thirsty for cold?
Not always. You know, people, what do you tend to go for? Do we tend to go for, because if we gravitate towards cold, then someone may have a warmer constitution, if you will. So we'd look at that as a possible sign that the cold is being sought out to kind of counter out this warm interior condition or pathogen that they may have come in contact with. If someone's more, if they gravitate to room temperature water, they may be cold often. They may want to try to put clothes and blankets on, all layers upon layers, and they still can't seem to warm up. That's a big sign for us. That tells us they have a cold sign, and they gravitate to warm foods too. Spices. Do you tend towards greasy foods? And we take this very...
Right. God, really?
Yeah, we take a very detailed intake. Foods you eat, quality of sleep, things you gravitate to as far as drinking. What do you like to drink, warm or cold? And we take all this information, all of it, and we take it, and with the tongue and pulse, and we'll get a complete picture, and we'll be able to say, well, you know, you have nausea and vomiting because you have a certain pathogen that might be warm in nature, or dry in nature, or damp in nature. And after we've gone through all these questionnaires, we're able to formulate a rather specific diagnosis, and that guides us towards how to treat it.
So you don't treat with drugs usually either. I mean, besides the acupuncture, you don't really do drugs.
No, we use Chinese herbs,
Right.
but those definitely aren't drugs.
Right.
I do a lot of food-based healing, which that gets into a little bit more of my QiGong training. We believe people have energy. We believe food has energy. You know, certain foods are warmer, certain foods are colder. Same with the herbs. So the Chinese herbs have warm, dry, damp nature to it. And so after asking all these questions, we'll customize a treatment plan for the individual.
So, and that includes the acupuncture, how many treatments they may need?
Everything's customized after a very detailed intake.
It sounds like it's 2 or 3 hours intake.
But it doesn't take too long. Sometimes I'll send them home with a little homework to fill out and bring back. But yeah, the more details, the better. But you get kind of good at, you know, extracting the information, and then formulating a treatment plan. And that's what we do. That's what we do every day.
So give me an example besides the back and the normal things people talk about. Why a lot of people go to acupuncturists because of back problems, right?
Yeah, oftentimes they come in for back, but let's say they come in for insomnia or fertility or, you know, digestive issues of many kinds, irritable bowel syndrome. There's a whole list of things that people come in for. I'd say usually people come in for back pain, headaches, shoulder pains, orthopedic issues, but there's stress, depression we see a lot of.
Oh, depression? You mean acupuncture works with depression and
yeah, a lot of
stress?
people are overworked and stressed, and there's a lot of depression. There's a lot of digestive issues. There's a lot of insomnia. There's a lot of anxiety. There's a lot of fertility issues. We see that often. I'd say one of the main things, this is an arena that I'd really like to work in sometime, cancer treatment.
Oh, that's
Is a not instead of, in addition to. People go and have chemotherapy, and they need to. You know,
Right.
we don't want to work. It's not instead of, but they come back depleted. They come back nauseated. This is where we help a lot. There's lots of evidence for this too. There's lots of research that I often direct people to when they come into my office.
So if a person has cancer
Yes.
and they've gone through all the treatments, then they come in to you, and you could, or do you work with them at the same time they're going through the treatments to?
Not usually. Usually I'd let them do their chemotherapy.
Yeah.
Some people want to, but I'd say no, just do that, and then when they're done with that, they have a few days off, or sometimes they've done like a course of 4 treatments or 4 chemotherapies once a week. Sometimes they'll come in between the week before their next bout of chemotherapy because they're nauseated, and they're weak, and they want a little boost, they want a little energy, and there's no side effects. They work really well together. So, and a lot of things with cancer patients is they stop eating. And so we really got to keep them eating. That's a sign that we want to keep them eating, even if we have to spoon feed them. So the acupuncture comes in there, and it really helps. It really does help. I have lots of cases lots of examples. So it's really.
Does it help? I mean, since they've gone through the radiation and the chemotherapy and everything else, does it help to reduce the cancer coming back? Because they say lots of times cancer can come back too.
That, I don't have a lot of research on that actual, I mean, that's probably more, from my experience, that's more the Western side.
Mm-hmm.
They take care of, the radiation of the actual tumor or whatever we're dealing with. And then we deal most often with, there are some herbs that will help with that, but I don't have a lot of experience with actually using it that way. I like to let the Western world do that part of it. I'll do my part of it. Keep them eating, keep them healthy,
good
boost
food.
up their immune system, and get them ready for another bout so that they can tolerate another bout of chemotherapy. Some people are so weak they can't even take another bout. They have to discontinue the chemotherapy. So oftentimes we can help in that end too. So
how are the doctors with you with the acupuncture? Are they?
I haven't had a problem.
Okay,
Yeah,
so
I've
so
never
they
had
go
a
back.
problem. Yeah, because it's very benign. It's not going to bother them at all. Sometimes you have to wait a little bit of time after a chemotherapy session. You have to wait a couple days even to eat fruits and vegetables. Sometimes they're really depleted, but we try to get them eating. We blend up these smoothies and really masticate the food and the vegetables well, so it breaks down, much easier to take, and we can spoon feed them.
What about infertility? Because a lot of women and men are going to the doctors with whatever they do with the infertility.
Well, some like to, that varies a lot, because some like to work strictly with a natural approach. Others, most of the time I've worked with them,
Mm-hmm.
but that's both too, that varies as well. Great results. Me personally, I've done about 50%.
That's good.
So yeah, people I've seen, about 50% of them have conceived. And yes, there are some that didn't, but most people feel quite happy with it. They've tried just about everything before they come to us, because not many people think of acupuncture and fertility.
No, I never did till you, because I hear my brother, my brother-in-law is an acupuncturist in Orange County, and we've talked about this, but we've never talked about infertility.
So a lot of this too, with fertility, you just want to get someone as healthy as they possibly can get. That's kind of my approach. And so I get into things like breathing, and that now we start getting into QiGong as well. So we have acupuncture and the QiGong. We have the herbs as well, the foods. We just really try to get someone's constitution as strong and healthy as possible. And at that point, they're in the prime position to conceive then.
Now, do you work with pregnant women too?
Yeah.
Do you work? You can do acupuncture, and when they're pregnant, like 8 or 9 months.
Yeah. Yes, but not all points. There
Right,
are
well,
some points that are off limits at that point. Okay. But back pain becomes an issue at that.
Oh, yeah.
So low backs. It's time to. We want to get the We want to deliver. I imagine that's what I hear all the time. They want to deliver, and they
Yeah.
want their backs are killing them. So
Exactly. Yeah. Yeah. Well, yes, because everything's going
Yeah.
forward.
So we see them for that too.
Now, how long have you been doing qigong? I mean, acupuncture. I was thinking about
So acupuncture.
How long have you been doing this?
What
now?
has it been now? It was 2001 when I finished school. So I've been doing it for quite a while. I've been here in Monrovia with my coworker, Teresa. She opened the office here.
And Teresa's last name?
DeAndrea.
Okay.
Yeah, she opened the office here in Myrtle. And then a friend of a friend told me about her. I was doing house calls at that point, which I still do, but I was looking for an office. A friend of a friend told me about Teresa, and here we are. We've been working together for quite a while now.
Now, does she work the same way you do? Are you just, you have different ways of seeing things, or do you work with clients as a whole? Like if you have a client, is it?
Yeah, we have very similar approaches. Our office, pretty much when someone comes in, we're going to see them. We don't have 2 or 3 rooms where we're dropping the needles and going to the next one and an assistant pulls them out, or we're really trying to be with that person, because as I said, there's a lot of questions, and even after you've seen someone for a few times, you know, things occur in their lives, and I think that rapport is important for people, and they appreciate it. Both Teresa and I approach it the same way. We spend the whole time with the patient.
So there, yeah, because there are, they usually have 2 or 3 rooms, and they're pinning one. And,
yeah, and they're
and
off to the next one.
Well, but you're relaxing in that half hour. They're gone.
Yeah, and sometimes people may want to just nod off or go to sleep, and
it's
that's
very
fine.
easy to nod off. I mean, you're off, and let's talk about the needles, because people, that's one of the scary things, right?
I should have brought one. I'd do a demo on my arm here, but it's
not like a shot.
they're so thin.
They're tiny little
They're
things.
so small and tiny and thin. I haven't tried to do this. I've heard you can stuff like 15 of them in a normal hypodermic needle. Of course, it depends on gauges, but they're super thin. They're super thin. And most people don't even feel it.
No, they don't feel it.
Some
you only
points,
feel it is when the energy from one point goes to the energy and another,
Right.
and you can feel that. I mean, that's happened to me. That when that energy crosses, you get hot real fast.
Yeah, yeah, and
but it's working, because I know if it's going from one point,
it's opening. Yeah,
it's opening up those. Talk about what acupuncture really is, because it's all that work with the meridians, isn't it?
yeah. So life tends to stagnate this optimal circulation of, if I can call it just an energy, or in Chinese or medical school they call it qi.
Right.
So qi is just a energy, you know, a life force, if you will. And you have to indulge me in a little Chinese medical theory. This circulates through channels or meridians. Some are responsible
do they go north and south, or east and west?
Most go north and south, yeah.
Okay.
They don't go all the way to the feet, but they're going up and down.
Nothing east and west then.
There's a couple going
there?
east and west,
Okay.
down around the waist. So life, illness, trauma, you know, lifestyle, stress, emotions, these can cause the circulation, the natural optimal circulation within these channels to stagnate. And so what we do with our needles or our herbs or my exercise QiGong, it's a way of rebalancing. It's a popular overused word maybe, but it really is a perfect word. If it's depleted in energy, we have to tonify it. If it's stagnant and this circulation is slowed down, we have to regulate it and maybe pick up the circulation a bit. You know, if it's too much, you can suppress it. If it's stagnant, you circulate it, as I said. So we reestablish this natural, optimal circulation within all these individual meridians. Some meridians are responsible for reproduction, others for digestion. So when you find an issue through that long intake that we have,
Right.
that'll direct us to a certain meridian or channel, I call them rivers of energy. That's what, it's more like a river, I think, if
Okay.
you think of it that way.
Yeah. So if there's a rock in the way,
We got to remove that
you
rock.
got to remove the rocks. So, all right. So yeah, it's like a river.
Yeah.
You've got pebbles in the way, but if you've got a big rock.
And we felt it, like when we get a real emotional, we feel we got a lump in our throat or something. I mean, we can feel sometimes, not all, sometimes we don't feel, but other times it's very noticeable. Just is not really.
Yeah, when you're upset, you always get that. Or you've got a big speech or something, you get that terrible knot in your stomach.
Right. Stress often leads to digestive issues.
Yeah.
So we work with that and we regulate it, and then people go off into the real world and hopefully make the adjustments, and we talk about all of that, how they got there, changes they can make, and whether it's acupuncture, usually some sort of exercise helps.
Oh yes. So now let's talk. Since you mentioned exercise, let's talk about the qigong, because when I first talked to you about qigong and it started coming, I didn't know until my brother-in-law said he does qigong too. So the two of you, I thought this is very similar. Why are they both doing?
Yes.
And he says same thing.
But he's the acupuncturist, right?
He's an acupuncturist. He's been doing qigong 30 years.
So when I started in acupuncture school, that was my first exposure to qigong. You have to take, in California at least, 1 semester of Tai Chi and 1 semester of qigong. I've been told that Tai Chi is a type of qigong. Other people kind of, might take issue with that, but they're very similar. The point is, that was my first exposure to it, and I realized that was something really resonated with me. I wanted to get back to it. As I said, after I finished my school, Logan came around, and so I didn't really dive into qigong right away, but I knew I'd get back to it. Got Logan set up in school, and he's up and running now, and so I really dove into qigong, and it works so well with acupuncture. We're working with the same qi, the same life force, the same energy, if you will.
And the meridians.
Yeah, except instead of using needles, now we're using an exercise. And the foods, it was very easy to work with foods and the healing aspects of foods. I got some of that in my schooling. And then it kind of reinforces the Chinese herbs. It really has been they work so well together, acupuncture and qigong. So.
Explain qigong, because I don't think the average person has seen it.
Well, they may have seen it at a park.
Okay, but
or
it's not.
At least Tai Chi. They may have seen Tai Chi in a park.
But qigong's a lot slower than Tai Chi.
So qigong really is just slow repeating movements combined with we align very slow breathing, breath work, slow repeating movements, and meditation, all designed to strengthen and circulate this intangible substance we call qi, or energy within us.
When people come to you and you say, you're taking their whole history, right? So they know they're going to get all their needles and everything. Then you say, well, now I think you should take some qigong to practice qigong, and then you're going to have to change some of your eating habits, right? Mm-hmm. How do they handle that? I know this is the truth. They're thinking, God, do I have to get my
some better than others.
My French fries, right?
Some better than others.
Or my meat.
Yes.
Or whatever they want.
All right.
I mean, you probably, if you just went to acupuncture, you'd probably get 60-70%.
Yeah, but willpower is a part of any sort of spiritual discipline, and qigong can be more the meditative. I mentioned that it can be a spiritual discipline when practiced a little more often and deeper. Willpower is a part of it, and so if people want to come to us, they don't want to take pharmaceuticals. They're looking for an alternative, but most of the time.
But they don't want it completely.
Yeah, and so we can't.
They don't want 100% because they say I don't know how people handle the spiritual part of things, because that can be a touchy area, spirituality, and then eating, changing your eating habits. Do you try to do this and tell them all at one time, or do you introduce this gently and slowly?
Well, I think as far as spirituality goes, it doesn't alienate anyone.
Right.
And I think after they learn about it, maybe at first it might seem like, oh, well, that's different. And once they get to learn and try it, it doesn't alienate anyone. You can just think of it as meditating. And the food is challenging for some people. They say, Chris, I don't know, I'm not giving up my cheese, you know. You can talk till you're blue in the face, but some people aren't going to do it. They say they'll do these other things, and they'll try to do these other things a little more vigorously, but they're not giving up their
cheese
or bread or whatever it is that, in particular might behoove them to change.
Yeah.
So, but it's fun, and that's part of it. And willpower, as I said before, is a part of any sort of cornerstone moment. If we want to make a change, it's going to require a little bit of desire and willpower. The biggest challenge people have once they've decided to go and do this, whether it's the herbs or food, QiGong, acupuncture, or probably any other, it doesn't have to be in the Chinese medical world, people tend to underdose. And
What do you mean underdose?
Because when you come to take some herbs and you get a capsule, some of them are encapsulated, some of our herbal formulas, people are used to taking 1 or 2 vitamin C's, maybe a couple, maybe 4 a day.
Well, that's enough, yes.
Yeah. So, people don't like to drink the teas.
Oh,
so
I've
that's
never
one
had the
thing.
teas.
The teas aren't, it's not like...
herb tea.
Yeah, it's not the best.
It's not like having chamomile tea or Earl Grey,
No.
right?
It's different, It's medicinal, if you will. So, but people tend to underdose. They don't take enough, and we have to take, sometimes 9 of these little capsules, sometimes even more. And so...
In one dose?
A day.
Oh, but you can split...
You can split it up.
Oh, okay.
So people, they decide we don't want these pharmaceuticals.
Are they big, like big capsules?
No, they're normal sized capsules.
Okay.
But I recommend that anything we're doing, that we do it all, we talk with the doctors are on board. If someone's, going to change, if they're diabetic, you got to talk to your doctor, if we're going to make some changes. I could recommend some foods that might help, but we work with the doctors.
Diabetes, because you don't want them.
But I try to do that with any
Okay.
and not just diabetes, but you have to be very strict with diabetes, of course. But really, we want to work with the doctor, especially if they're on a pharmaceutical. Don't stop taking your pharmaceutical, and
See, I think a lot of people think when they come to acupuncture that they can give up maybe the drugs that they're on, and go the whole natural way.
What we want to do is have the doctor look at the lab results and say, I have no idea what you're doing, but keep doing it. If you have osteoporosis, your bone density is improving, and the doctor, or if you're anemic, your red blood cell counts come up a bit. These are all things we work with, but my favorite way to do is when the doctor tells us, or tells the patient, I don't know what you're doing, just keep doing it. Comes back and sees us, we keep doing it for another 3 months, and people think 3 months, that's a long time. But this is not immediate gratification pharmaceutical thing. So if we want to go the natural path, it's a slower process, depending on what we're dealing with. If someone has a headache, we can usually take care of that pretty quickly.
But then you're going to want to know, do they get headaches a lot, blah, blah, blah.
Right. But if someone's anemic, that might take a little bit more time to really build up the levels and whatnot. So you go back and they take a lab test and they say, keep doing what you're doing. They go back after another 3 months. Then the doctor, he decreases the medication. That's how I like to do it. And then maybe we get a phone call from a physician, and then we develop a new relation. And that's how I like to work with the physicians. You know, please don't stop taking the pharmaceuticals, because that's not good for anybody involved, really. I think we work together as a team, play to our strengths, and that's the safest way. That's a safe approach to do it. It's a responsible approach.
It's very responsible, because sometimes we can go over one way or the other way, and I'm more like you, I guess,
Yeah.
more middle of the road, and
Yeah.
take what you like from each one and just use what you need, and that's what you're basically saying too.
Yeah.
What about the food? Some of the diets very, you know, like you said, no cheese.
Yeah.
I'm sitting there thinking, I like my cheese.
Yeah.
I like my bread.
People like their cheese.
And
I
they
like
like
my
their
bread.
bread.
I do. But again, it's individual. You know, you customize this for the individual. If gluten-free diets are very popular now, but I differ from certain people now. I mean, if I'm not gluten intolerant, I don't really see that there's a problem with me right now. Maybe, and I'm always studying and learning, so maybe my opinion will
How would somebody know if
change.
they're gluten intolerant?
Well,
How would
if
you
you had
know that?
celiac disease, you would know for sure. That would be a diagnosis.
What's
but
celiac?
and that is an inflammatory disease in the colon, and that's what usually happens with gluten, is people have this inflammatory response. And
Okay.
so you cut that out, but that's a tough one for people, you know, to give up once you're used to eating bread, or, you know, that's a tough one to give up for a lot of people.
I've cut down. I like my bread, I really do, but I've cut down to rye.
Yeah.
I like my rye bread. Of all the breads, I decided rye was my favorite,
Yes.
so I watch it, but I still like my bread.
Yeah, well, it's, you know, it might be okay for you. For a diabetic person, maybe not. Oh, and so we gotta.
Bread's a comfort food. For
Yeah.
me.
So we
I mean-
really want to focus on the customizing for
Right.
the individual.
And
Take
then,
each person separately.
and then you believe in blending. I mean, because I've had your smoothies
Yes.
here, and I was telling somebody you take the whole pit of the avocado.
I do.
Okay.
Yes.
Now why? And they asked me why, and I said I don't know. There's something in the pit, but I don't know what's in the pit. What's
Well,
in
there's
the pit?
lots of research, and I have to say that this came from one of my teachers. I didn't come up with the idea to throw half an avocado with the pit in a smoothie, and you had it. It doesn't taste bad. It tastes
No,
pretty
it
good,
was
right?
fine. Yeah, but
It actually
when
tastes
you're
good.
telling me, I'm thinking this pit is big,
Yeah.
you know, and
Well, that came from my teacher over at Supreme Science QiGong, where I've studied a lot of my QiGong. And so it is just loaded with soluble fiber. And that's something that the Cheerio box, you get a gram of soluble fiber, you get the American Heart Association logo on the box of Cheerio for 1 simple gram. An avocado has 3. In average avocados, there's different sizes. Actually, the Haas, the smaller ones, have a more dense concentration. But that has about 3 grams of soluble fiber. But the seed, that is the highest concentration of soluble fiber of any known food I've come in
Really?
contact with. Yeah. And the research is out there. There's not a lot here, but in Japan, there's amazing research going on. So I often refer people to the research. Don't have to take my word for it. Go do your due diligence, and I'll steer them in the direction. And sometimes they come back to me, and then they're satisfied, you know. But it's completely digestible. It'll help scrub the cholesterol from our vasculature. It'll help with digestive issues. It'll help with number 2, if you will. You know, if we're constipated. Soluble fiber is harder to come by, but that pit gives us so much of it, and you don't taste it. There's no taste.
no, there wasn't. How much of this do you recommend? I mean, with these smoothies, like this avocado, and you put everything else in.
Well, we got to eat food, or I recommend eating food. My teacher that taught me, his name's Jeff Primack, he he endorses the same thing. Eat. You know,
No,
we're not on a smoothie diet here.
I
But
mean, smoothies are great, but there's something.
Yeah. We want to eat.
I like enjoying eating.
But the smoothies have another benefit. If you have a really powerful blender, you can't put that pit, I should say, the avocado pit, in a normal blender.
No.
You need to have a strong
3 horsepower.
3 horsepower blender, or else it's just going to bounce around. It's not going to. And so what we want to do is we have such a powerful blender, run it through 2 cycles on full power, because I've heard someone say it's not so much we are what we eat, we are what we absorb, and we don't chew a lot. We're speeding through our life, hurrying up to get to point A or point B, and we don't chew that much. Pop this in a blender for 2 cycles, 50 seconds, and all these nutrients are down to the micron size, and we can absorb all these nutrients, and they get on board. They're absorbed much better, and we simply can't chew as good as those blenders can. So they do all the blending for us, and we just take maybe 20 ounces a day, maybe 40.
And what do you have? You put a lot of things in. You put strawberries in, and just you can put anything you want in.
Strawberries, apple, beets.
Yeah.
Beets are very therapeutic.
So 20 ounces.
Yeah, about 20 ounces a day.
That's
and we have a lot of recipes and formulas to give people some guidance with that. I like to see them take a probiotic. It's pretty important. I've brought it up a couple times, and I hope it's not awkward. But we want to take out our trash. We gotta do a number 2. You know, we gotta go.
So,
and so these smoothies help.
Trash.
Sorry,
It's
you gotta
okay.
take out the trash. You know, I
Yeah,
say
you're
it in
very-
the office all the time, and I'm used to it. But it's always a little odd when we talk about that. But people are, you know, we talk, we get into these questions, we get into everything, and so we want to know, are we going every day? Because we want to have a really healthy constitution. Is oftentimes that's a yardstick to use or a metric to use. Or, you know, how often are we going to the bathroom? So
how many? If a person comes to you, did you put them on like a 3-month plan? 1
depends.
month?
It really depends.
Okay.
It depends what they're coming to see me for. If they have a headache, I'm hoping that 1 or 2 treatments, because sometimes they'll call and say, you know, Chris, just please, can I just come in? My head's killing me, and we'll try to take, you know, someone who's on if they're rating it at an 8 out of 10, we'll bring it down to a 5 out of 10. Let them get a sleep, and they're better the next day usually. Other things don't work like that. I mentioned anemia before. You're going to have to build that up for a while. Fertility, of course, you're going to carry that on until, you know, there's a pregnancy. So it depends what it is. It just depends.
So you come up with this complete meal schedule.
Customized, yeah.
Yeah, I mean.
Some people don't want to do the food. We don't have to do the food. Some people don't want to do the needles. Some people are scared of needles.
So they don't come to you for needles, but they come to you for food?
Well, they usually come for acupressure or something related to acupuncture.
No, wait, what's the difference between acupuncture and acupressure? The one doesn't have the needles?
Yeah, we just use our hands.
Oh, okay,
Yeah.
okay.
And so people come for that a lot. And usually they'll try a needle eventually. They'll say, okay, I'll try it. They try it and then they're fine.
Is it the same? I mean, do you get the same results from the acupressure that you do from the acupuncture?
Sometimes, but sometimes you really want to use the needle. And so I hope that sometimes people will be comfortable enough after talking with me and, you know, maybe trying acupressure. I do a lot of cupping. People like that.
What's cupping?
Cupping, you take this cup that looks like a small fish bowl and you create a vacuum in it. You can do that just, I don't want to alarm anyone, but you just take a little burning alcohol swab, you put the cup on, and all of a sudden you have a vacuum in this hand. And then you put it on someone quickly. There's no flame in the cup at all. It's just a vacuum. And you blow out your your burning alcohol swab. That's separate and done. But you've created this vacuum and you put it on someone's back usually, or their legs, somewhere where we want to increase circulation, because you got this vacuum. And when you know the attachment, and I like to use moving cups myself. Other people just put them stationary. And you may have seen people like at a pool, a public pool, and they have these perfectly symmetric circles on their back.
I've seen people. So that's
Yeah.
cupping?
That's cupping. I like to move mine to really oxygenate the tissues and the muscle bellies and just get oxygen to the fibers. That's what a muscle needs to relax. It needs oxygen. It'll contract without any oxygen, or the energy, the ATP, the energy derived from the metabolism of oxygen. It'll contract. The muscle fibers will contract without it, as in rigor mortis. It needs the oxygen to release. And so we take this cup, we pull this blood supply into muscles that might be muscle fibers that might be kind of tight. You kneading it down, you break it up, and you're pulling this oxygen in, and they do relax. You can feel it before and after.
Is it like a massage without?
In a sense, but it's like a massage, turbo massage sounds painful, but it's a more effective massage, I find. And most of my patients would
rather
agree.
than the kneading and all that.
Well, you're doing that too, because you're causing circulation. But you put someone under a heat lamp, you vasodilate and encourage vasodilation and oxygen delivery. You got this kneading and massaging. That's going to break things up and cause vasodilation and more circulation. The suction is where the difference is. And you put it down on an oil that's also a therapeutic oil of some kind. I like to use coconut oil to nourish the skin.
You just don't put it on the back. You can put it on people's arms and legs.
You can put it on the arms. You realize where in the shoulders, the legs. Yeah.
Oh, I didn't.
I like
know
to
that.
put on the soles of the feet.
Oh,
For
because-
plantar fasciitis, or someone has a sore feet, and you just stick a cup on the bottom of their foot and rub it. Bring a lot of circulation there, and they really like it. So
I go to sleep.
they go to sleep.
That,
They'll go to
I
sleep.
can imagine that. They would go to sleep.
Yeah.
That's really, really fascinating.
Yeah.
I know this. So so you can go in. Okay, let me get this clear. So you can go in for acupuncture, right? Here I go. And coming in for exercise and diet.
The QiGong, the QiGong we do at the
Community
center up there.
Yeah.
So they can contact them for that. I don't do that at the office, but we do some food-based nutrition and healing. We do the acupuncture, of course, the needles, the herbs. We have our office is full of herbs.
So you prescribe the herbs.
Yeah, we'll make a formula for them. Or sometimes these general patent formulas that are already made, they'll apply. If someone has a weak digestive system, I know I can just grab this and say, here, just take 9 of these a day, and
I know. Are these regulated like medicine with the Food and Drug Administration? I mean,
you have to have a license for these herbs. You can't.
I mean, because they're not just
Yeah, these aren't just herbs. You can't just go to Sprouts and get these herbs, especially not in combination like this.
So if someone has, I don't know, whatever they have, you can make it up just right there.
Yeah. Oftentimes we'll make it right there, and we'll be.
So you have a degree in like herbology too, kind of?
Yeah, Chinese
wow.
herbs. Yeah.
Okay.
So you have to have that. That's part of the California State Board exam. Half of it might be acupuncture. The other half is herbs. So.
Why is it so strict?
California is one of the strictest exams. It's a much tougher exam. In fact, I took the national exam, not for the herbs. I just took the nationals for acupuncture in case I wanted to go to some other state and practice there too. That was a breeze compared to the California test. The California test is much harder.
Are most acupuncturists in California?
A lot of them, but no, I wouldn't say most. There's
Where the states where acupuncture? I mean, I can't see.
yeah,
I don't know about Pennsylvania. I grew up in Pennsylvania. Scranton.
It's there. Oh yeah.
Is it popular there like it is here?
Maybe there won't be the same concentration and density of acupuncturists. One of my friends went to Tennessee, so he's out there. I think he was amongst a few
Okay.
acupuncturists in his town. But states like New York, I
Oh,
mean,
yeah.
these dense
New York,
populate-
California.
Yeah, they're going to be
probably
Florida. They're
Florida. Yeah,
We're
a lot of
everywhere
seniors
now.
in Florida
we're everywhere.
and Oregon. Well, we're going to wrap up.
Okay.
So face the camera over here.
My name is Chris Tucker. I work at Integrated Health Services in Monrovia. Practice QiGong at the community center.
And your telephone number.
Telephone number is 626-359-1558.
Thank you very much.
Thank
I
you.
learned-
Thank you. I
learned a lot.
appreciate it.
I learned a
That's
lot about
great.
this.
Thank you for having me.
You're welcome.
Yeah, thank you.
This is Marlene Gibb with What Do You Do?
This program is brought to you by P. Murphy and Associates, successfully providing IT professionals to Southern California businesses.